If you saved 1% of that public procurement budget, 1% would pay for an extra 500 Gardaí on our streets.
Okay. Going back to government expenditure, Deputy Dolan, I know you've been quite vocal in this regard in the Oireachtas committees as well. The health budget is always going over budget year on, year out. And I know you've got new figures in relation to the HSE's spend on public procurement. It has tripled in the past 4 years.
Yeah, I was shocked at this, John, to see how quickly that spend had accelerated, and particularly given that this spend has gone from 1.29 billion euros to 4.19 billion euros in the space of 4 years. And that doesn't include capital costs. So that's just on procurement costs, where the HSE is essentially paying for things that they cannot provide themselves. Now, that obviously includes medication, and we welcome that, and that's a great way to support people. But it's the speed of acceleration of the spend that is the problem. And when we uncovered this in the parliamentary questions, this is something that I found quite shocking, and I have subsequently called on the Minister for Health to ensure that the integrated financial management system for the entire health service is rolled out as a priority. As you mentioned, I am on the Oireachtas committee for the public accounts, so I get the opportunity to scrutinise and look over all of the public bodies and how they're spending money. And the HSE, I mean, look, just to put it into context for your listeners, John, if you saved 1% of that public procurement budget, 1% would pay for an extra 500 Gardaí on our streets. So when you think about it in that context, or you think about all of the opportunity costs, you just have to be so careful, because the government wants to spend more, but we want to spend it more efficiently. And that's where I'm trying to add value to the government to ensure that any money that is spent effectively, efficiently, and that we're not losing out somewhere else because money was wasted somewhere else. And that's the fear, is that when you have an opportunity cost in one area, somebody else is missing out. And ultimately, we're all in it together as a society, and we want to see the best outcomes for this society.
What is the delay with this financial management system with the health service?
I have yet to uncover what the exact delay is. Now, I guess from my background as an accountant and experience, these things are very complex. And when you think about multiple hospitals, multiple primary care centres, every entity that goes into the HSE, it is a behemoth, it's a huge organisation, but even the more reason to accelerate the delivery of this integrated financial management system, so that there's full oversight across the board of how money is being spent and where it's being spent. Right now, that granular detail is not available. It's at a local level. You can find out the information. So you could find it out directly from the hospitals or from other hospitals. But we don't know where the system is truly losing out. We know the money in, we know the money out, but that granular detail is what I'm trying to find out, so that we can scrutinise it more and we can find greater synergies and efficiencies across our health system. And ultimately, that leads to better results for every single person that uses the services.
Yeah, are you concerned that some of the tendered projects are going over the contract budget?
Well, this is a huge concern, not just even for the HSE, but across the political system. I've asked over 190 parliamentary questions in the last few months on public procurement to try and get a picture of what's happening. And there is an issue. After a tender is complete, the payments that are paid out by entities are not linked back to that tender. So it makes it very hard for legislators and governing bodies to track them. Ultimately, these overspends, they're always caught after the fact, John. They're caught in the financial statements. They're caught when the Comptroller and Auditor General goes into these organisations and finds out. And we saw that with the Arts Council. We see it with the National Gallery. These overspends are horrific. And ultimately, people who I'm talking to on a day-to-day don't feel like there's any accountability for these misspends. And what really has to happen is we have to go a level deeper on it, and we have to track the payments and link them back to the original tenders. And we also have to standardise the reporting of data, because different entities across the country report the data in different formats, and that makes it harder to track at a countrywide scale. I essentially want to get our government to a position where they can have a dashboard in front of them that shows them almost in real time public spending across all public bodies. This would be so powerful and give the ministers even better insights to allow them to make better decisions in future budgets.
Is insourcing within the health service a big problem through things like the National Treatment Purchase Fund?
It's hard to say. I'm still trying to get to grips with what the actual impact is. I think, paying, using the National Treatment Purchase Fund to pay for someone's procedure or to pay for a process for them so that they have a better outcome is definitely worthwhile. And that is good, and it can provide value for money. I guess the most important thing is it can provide speed. The speed at which somebody can get support is quicker through the National Treatment Purchase Fund. But the problem then is people follow incentives, and if the incentives for our consultants are wrong, if they're incentivized to insource or to self-refer to their own clinics, that really isn't a good road for the HSE to be going down. And I think that's only going to become more problematic, because there isn't an incentive for a consultant to get through their waiting list rapidly within the hospital they're in. There is an incentive for them to see them in their private clinic, and there is a conversation to be had around that. I mean, if they're taking on extra hours on the weekends and extra time, fair play to them, because that's not simple either, and that comes at a personal cost. But I do think it's not perfect the way it is at the moment, as we all well know.
I know you're bringing forward a bill in relation to value for money. You might just explain that to us, Deputy Dolan.
Yeah, so my bill has received support of the Fianna Fáil Parliamentary Party. I'm hoping to introduce it after the summer. And essentially, I haven't finalised the name yet, but it's going to be called the Public Money Waste Elimination Bill. So I want to eliminate the waste of public money by providing greater transparency, by putting in place standardised formats, by mandating contract award notices on e-tenders. It's a big issue at the moment where on e-tenders, contracts are awarded, but the contract award notice doesn't go up. So, these competitions can run for a long time. But basically, my legislation is going to provide another layer of transparency and also ensure that ministers have more information to hand. My bill won't stifle or slow down the ability of projects to deliver, but it'll give ministers more real-time information on spending as it happens, as opposed to finding out after the fact that something has gone over.
Okay. Will it actually work though? Because sometimes things happen in the economy that are out of companies' controls, and inflation happens. Will it actually reduce, I suppose, wastage, Deputy Dolan?
Well, it's like there's a great analogy of the Panopticon Tower. It's essentially a glass tower in the center of a prison, and what it means is that you can't see into the tower, but you don't know if there's somebody in that tower looking out and watching over what's happening. And essentially, this is going to give that Panopticon effect. It basically means that people who are in these industries will know that the system is being better watched, it is being better managed, and as I said, the impact of even a 1% saving across our government would be hugely positive for our people. So even if I could have a 1% effect on government spending, I think that would be the biggest impact I could have as a new TD starting out.